All right. Hey, everybody. Hello, Get Better Faster Nation. I am Dr. Jason Bradley, and along with my co-host, the one and only James Chester, and our incredible executive producer, Rachel Bradley, we want to welcome you to another exciting episode of the Get Better Faster podcast, and this is not one to miss. Today, we are joined by Jason Padgett, a good friend of mine, former Hollywood actor who appeared in Spider-Man, Angel, 24, and many other things. JP's made a dramatic career pivot that could save American families, that could save you and your family many thousands of dollars per year on healthcare, true healthcare. After spending over a decade in entertainment, JP founded Connect MD. That's Connect with a K, ONNECT MD, in 2019, a revolutionary telemedicine platform that is genuinely disrupting the insurance industry by offering unlimited virtual healthcare for families of up to 8 members for less than $100 a month. You heard that right. Families up to 8 members for less than $100 a month. No co-pays, no deductibles, no prior authorizations, no insurance needed, and no one is denied. JP's mission is simple: make healthcare accessible and affordable for everyone, especially those abandoned by our broken medical system. This is exactly the kind of solution our GBF Nation needs to hear about and take advantage of. Without further ado, JP, welcome to the show.
Thank you guys so much for having me. I'm very, very excited to share the ConnectMD platform with you guys today.
Awesome.
And for me, I think we're going to take some deep dives on some really challenging topics that a lot of people need some clarity on. And, you know, there's so much value to what you're doing for the just mom and pop of the world and those families, those people that need clarity. They need something tangible, and they need somebody to connect with. And I think that that's where your brand comes in with ConnectMD. So your origin story. You went from Hollywood to healthcare innovation. Tell us about how your 3-hour wait in urgent care in 2019 changed everything. And when did you know that you had something that would help people get better faster?
Well, that's really interesting. So I moved back from California to raise my kids in Oklahoma, where I was from, and just started some medical companies because I have a passion about helping people. And to get to the urgent care, so I went to an urgent care. I was there for 3 hours and I was still 6 people deep. And I said, forget this. I own medical companies. I've got a Rolodex of doctors in my phone. So I said, I'll just call one on the way home, get a prescription, and that'll be that. So that's exactly what I did. So whenever I got home, I was like, you know what would be cool is if every person had access to providers like I have access to providers. That would be a great business model. And this is right before COVID hit. So that night I was walking around the neighborhood and was trying to think of a name for it, and ConnectMD just popped into my head. So while I was walking, I actually got on GoDaddy and tried to secure ConnectMD with a C. It was taken, so I got it with a K, and just started mapping out the business that night. I said, this is going to be a subscription model. There's not going to be any co-pays, deductibles, out-of-pocket expenses. They're going to pay one price and have access to it whenever they need it. So ConnectMD was born, in early 2019, and that's the story.
Well, I think that it's every entrepreneur's pathway. If you think about it, you had the idea, you're hot. You saw that there was a gap to fill. You saw that there was a need for it. But the real story behind this is not everybody's as connected as you. Not everybody has a Rolodex of doctors in their phone that they can just call up and say, hey, I need you to help a brother out. I need this happening because I'm stuck at this urgent care. Nobody's serving me, and I just need to get home to the family. So let's get this ball rolling. And then obviously I've created a few businesses, and the first thing you do is get a really good idea, and then you go search for GoDaddy and see if the domain's available, and then you secure that thing, and then it's off to the races from there. So it's the entrepreneur journey, but you have a real purpose behind it.
Yeah.
Oh, sorry, JP, go ahead.
No, I just said the purpose behind it is, I think, I'll give you one quick story that made me think of this idea a little bit before I was in a house because I own medical company. So I went to this lady's house. Don't remember her name, not really important, and she had he was about 4-year-old boy sitting there, and he had the worst cough I'd ever heard of. And I said, man, you really need to get him to the urgent care. And she goes, well, either I can take him to the urgent care or I can feed him. I can't do both. So that really, really hit me hard. And I was like, you know what? People cannot afford care. And then whenever I was creating ConnectMD, I said, I need to price this where everybody can afford this. And even if they have insurance, this can be a first line of defense before they go, with their massive deductibles. I'm sure we'll get into that later. So.
Yeah. And I just want to thank you for the segue, because I wanted to just share how we found you. And that's Rachel and I, and got connected with ConnectMD. And really what our first experience was, which then turned me on to it, because as soon as it worked, and I don't know how else to say that, but as soon as it worked, I was like, this is going to disrupt everybody in a really good way. I mean, not everybody in a good way. The insurance industry probably doesn't like it, but at the same time, what you're putting out there is amazing. So, mutual friend of JP and of ours recommended that we connect with your company and join as a member and check it out. So we did. And I think this was back in August of 24. And shortly thereafter, unfortunately, Rachel came down with what we now know as COVID. I had just gotten over COVID. I had tested positive, and it hit me hard, whatever that was, that comes with that. And I woke up on a Tuesday. I think we joined ConnectMD as members on like a Sunday. I woke up on a Tuesday and I'm like, hallelujah, I feel better. And Rachel said, I don't feel that good. So I said, not great, but I'm like, this is great. We can use that ConnectMD and check it out and see if it really works. So JP, this is what happened. We got in the queue with our regular health insurance, and it's one of the blues. And we have a high deductible like everybody else in the country. And for us to go to the urgent care, just the walk-in urgent care, even without the deductible, it was going to be $75 just to walk in the door. And really, if we were going to go, what Rachel really needed was probably just some fluids and some rest anyway. But at any rate, we decided not to do that. Check out ConnectMD. And I kid you not, she logged in, and 9 minutes later, 9 minutes, no wait time. And I don't know if that's typical, but it was 9 minutes for us. She was face-to-face with a doctor on her phone. We had a COVID test because everybody had them, sitting around. So ours had tested positive. Right. And he prescribed whatever, he thought that we needed, and then ended it with, we can get it to your pharmacy, which is right down the road, or if you can't get there, we can ship it to you. I was just amazingly impressed with it. And then it was that quick, took good care of us, very quick. No, we didn't have to drive, wait for 3 hours. We didn't have to spend $75. I think whatever he had prescribed was, on the list that was, no out of pocket for the medicine. And then surprisingly, a couple days later, ConnectMD called Rachel to check on her just to see how she was doing. And that was floored by that. That was our very first experience. And from that moment, I started recommending it to my clients, to my friends, to my colleagues, and everybody that I can get to listen to me, that this is a game changer in all of it. So I just want to say thank you for our personal experience for that. I don't know, just say thank you. Anyway.
You're welcome. What's interesting is one of the hottest things right now is concierge medicine. So a lot of doctors are shutting their brick and mortars down so they can go into concierge medicine because they don't have to mess with the insurance companies. And it's very hard for them to get paid on certain things. And we can get into the insurance company stuff later with the high deductibles, and it's just kind of a mess. But concierge medicine's $500 to $1,000 a month for an individual, one individual. So we are concierge medicine for everybody, because you shouldn't have to pay that high of a price and be treated well. You don't have to pay $500, $1,000 to do it. So everything we have, all of our memberships are under $100 for your entire family.
Listening to Dr. Jason's story, and listening to your big why around the product and the service to people, I just think that there's a huge gap that you guys filled. And I'll keep going back to the uniqueness of what you guys have done. As people know, emergency rooms are open 24 hours a day. I like to say yes or yes. And when we get to that second yes, I get to the next question of what do you do after 6 p.m. for your family when something happens? What happens when there's a backyard incident, or there's a auto crash, or there's something that happens where you just need advice from a doctor? What do you do? Well, I think, 75% of the offices close at 6 o'clock. There's a 25% open, but are those in your community? Do you live in rural areas? Like, where do you go? And that's a scary moment. Like, what do? You're going to call the ambulance. You're going to call somebody, and it's going to be a whopping bill. So I think what you've done is you've created a system that gives people peace of mind. And I think the peace of mind for less than $100 is is an obvious approach for most people. They just don't know you guys exist. Yeah. And I'm sure most people would say, I need that tomorrow. I need that today. Just like Dr. Jason and Rachel had it. Like, I want that like immediately.
Well, yeah. And I think, JP, I'm going to turn right over to you. The thing too, to kind of underscore what James is saying, and this is something I actually learned from you, JP, and I don't know the exact number. And as Rachel would say, my wife, 98.3% of statistics are made up on the spot, right? But at any rate, I think it's between 40 and 70%. I think it's closer to 70% of urgent care walk-in type visits can be handled via telemedicine. It's a massive percent.
It's actually around 80%.
Okay. Yeah. I didn't want to overshoot it. So I wanted to pitch that back to you. Yeah. So tell us about that.
So, 80%, and also people that go into the ER, like James was saying, people that go into the ER for non-emergency events. Mm-hmm. I mean, it's $1,000 to pull up in the parking lot, and but there's nowhere else to go, especially in rural areas. I mean, there's nowhere else to go. Where are you going to go? So with, all you do is have to pick up your phone and call ConnectMD, and they can handle, 80% of everything. It's cold, flu, sniffles, UTI, rashes. You can get advice. In our platform, you can get online and message a specialist, which we can talk about later. There's sports medicine, there's allergists, there's all kinds of doctors on there that you can just message if you have a question, because a lot of times people with questions will make a doctor's appointment to get their questions answered. So, this platform we have is so robust and can save, the average person spends $1,400 a year in out-of-pocket expenses, not including their insurance, and a family close to $4,000 a year.
Yeah.
And, to have us as a first line of defense before any of that money is spent is money well spent.
And I just want to go back to the money well spent. I know that we've mentioned it, but I want to say it again. It's less than, you have a number of different programs, different kind of levels of platforms. And of course, as you scale up your ladder, there's more services included, but your premium is less than $100 for a family of up to 8 people, yes. Which is amazing. So I'll say it again, because people always question this. It's not per person, it's for a family. It includes all the telemedicine, if they prescribe meds, the meds can be included as well. Explain to me, because this is the question everyone says, how can you do it? How can you do it? Because we've been told that it's $600, $800, $1,200 for a family of 2 just for insurance. I mean, how can you do this?
We do it very simple. Whenever you go to 7-Eleven, how much does it cost you for a bottle of water?
$2.
More than that.
I don't know.
Smart water, $3.75, $4 okay. For smart water, whatever that price is. But when you go to Sam's Club or Costco, when you go buy them in vats,
okay.
So we do it in bulk, so you get membership prices, so everybody enjoys in that. So, and to be honest, you might use it 2 or 3 times in 1 month. You might not use it for 6 months. It's like AAA for medical. I've had AAA since I was 16. I'll be 55. So whatever, how many ever years that is, 40 years, 41 years, or 39 years. I've used it 4 times. So, but it's so nice to have when you need it. And some people, and this is a little bit different in that people do need this, and healthcare doesn't have to be so expensive.
The other thing I wanted to say too is the portability of it, right? So, I mean, this is just another interesting thing. As an example, our 2 daughters in our family are dependents, and they're on our program. And as JP and I were talking about, our older daughter is staying out here on the Maine coast, which is where we are today, finishing her first novel. And our other daughter took off west to California and is getting ready to set up to work clearing some trails and whatnot in Utah as the season dies down, which I'm excited for her. But nonetheless, it's my 2 babies and they're gone. And now I told them, here's your dashboard. Here's how you log in. If you need anything on the road, like you can just log in and talk to a doctor in a few minutes. And I can't tell you how, as a parent, how good that makes me feel and how much safer. And then as kids, they were just like, yeah, I don't have to. That's wonderful. I mean, and again, kids are, they kind of poo-poo that stuff, but they log right into their dashboard and they were like, oh my God, this is great. So again, it's comforting in that way as well.
Yeah, no. And, we let people put their family members on there, up to the age of 25. Yep. After they're 25, let's get your own membership, so, but yeah, it's great for college kids, because going to a college ER or whatever they call those is sometimes kind of a struggle. But just picking up and calling, and plus we have the therapy on there that with the $99 plan you can access a counselor whenever you need one. So that's great for college kids and kids are all people. But yeah, it's an amazing thing to have for the kids.
And back to this whole thing of filling the gap, like you saw where there was a need and you filled the need, and then it started to probably say, okay, there's another door that just opened. Wow, that's pretty amazing. And you're like, well, now it serves this population. Well, that's great. And now it's helping kids on the road, and now it's helping kids in college. So there's a demographic that fits into every door that opens up, and everybody can find the necessity in having a service like this, which I think that's the big equalizer for people, is they're going to keep on thinking like, who else can use this? How can we use it for the elderly? How can we use it for the mentally, like challenged people? How can we use it for people that are dealing with psychology issues? How can we use it for people that, just need to talk to a doctor about their insulin? These things that are real life and they come up all the time. Or my somebody in my family just fainted. What do I do? Like real life things. Or we had an incident in the pool. What do we do? Like it's the emergency model, but it's also the concierge model. And I think that it fits into a lot of different quality of life things that people just need advice. It's like back in the day when the internet started, you'd be able to ask Jeeves. Now it's Chat GTP. And I think when you have a question, you need it. Now it's Connect MD. And I think it just makes sense that there's a system like this. As I complete this stream of consciousness, how did you build the team to cross the borders for 24/7 care across every state and have somebody that's able to help these people that use it like AAA? Like, I need you in Utah. I need you in Georgia. I need you in Maine. I need you in Colorado. How do you find that quality of service?
You have a lot of physicians who this is how they do their business, and they're licensed in many states. So it's a tedious process to get it done, but and there are more and more providers wanting to do this business model, because the calls are 10-15 minutes, and they're getting paid for the call, and they don't have to worry about insurance or anything like that. So it's a tedious process, but we have a lot of great partners around the country that we are partners with. So it's been a really amazing thing. It's difficult at times, but it's with any business you're going to have difficult times, but it's been so great. And our physicians are amazing. Our pharmacy partners, which we can talk about in a second, our pharmacy partners are amazing. Our lab people are amazing. It's just been a great thing, and these people really want to help.
Yeah, absolutely. And like I said, I think the team that you're assembling is like I said, I feel like I'm gushing on this call today, but honestly, I don't know how not to gush on. I mean, it's $100 for 8 family members, and you get all this and more. I feel like we have the and more part that we haven't even gotten to, right? Yet, just wait, there's more. But I want to go back to the pharmacy because I was talking to a family member of mine and I can't remember the specific medication, but he had actually had a heart incident, a serious one, and had been prescribed some type of medication. And his out of pocket just for that med, he had good insurance, and whatever deductible he had been well spent on whatever, but nonetheless, his remaining out of pocket for this drug, I don't remember what it was, but it was over $100 a month. And we were looking at the list of drugs that are included, for primary care with KMD, and his med was on there. And he's like, wait a minute. So for $100, I could have my whole family on and just meet with that doctor, and then they can recommend that, I'm like, I think that's the way it works, man. And sure enough, that's what happened. And so he's actually getting his med. I mean, it's covered with, it's included with ConnectMD. And it's less out of pocket expenses. Plus he gets all the other benefits. Yes. So, Rachel was texting me in the background saying, really hit like how much of a savings those medicines are. Can you tell us a little bit about, because when I first joined, it was acute care meds, and then it was acute plus maybe some chronic. It kind of depended, but tell me about the medical coverage.
So we have 3 different plans. Let's start there. We have a silver plan that's $60 a month for the entire family. That's urgent care. They get discounts on vision, dental, chiropractic. So we have a whole list of those people around the country, and you can find it, on your portal, our people. And then you get the top 38 medicines that are prescribed during telemedicine for zero cost. So if you need prednisone, if you need Zithromax, if you need, which is Z-Pak, if you need amoxicillin, it's going to be zero cost at any pharmacy you have. Once you join, you have a ConnectMD pharmacy card, so you can take that down there. Our second plan is a gold plan that includes all that, what I just talked about, plus the therapy. We can get a counselor on the phone 24 hours a day. Mm-hmm. And then our platinum package, which we've been talking about most, the $100 one, includes all of that, plus you get chronic medications. Mm-hmm. So, and you get those for zero cost shipped to your house. Mm-hmm. So, and there's a list of now over 1,000 chronic medications that you can get shipped to your house for zero cost.
And that list, like that formulary list, I mean, it's robust, like you said. And I mean, certainly I think you can cross-reference it. And, some of the name brand,
well, they're all generic.
Yeah, these are all generics. Yeah. But honestly, I'm not telling anybody to take any meds here, but I personally feel safer with old school legend meds that we know have been around for a long time than all this new stuff that they're putting out. If you have to take anything at all, I'm not promoting anything. That all said, I want to go back to behavioral health because I think it's a really big piece again, and that's at the gold level and above, right? The gold and platinum levels.
Yeah. So
this is interesting because, our older daughter just graduated summa cum laude from university, I just have to say, with honors in psychology. She's so brilliant. And her whole, projects that she was working on, we're talking about the disparity of the need for counseling and behavior counseling and therapies and all those types of things. And then the availability. And in fact, Rachel and I, have many friends around. And so we started asking some of our mental health providers, what's their availability? And they literally say, they're like, we're turning people away. There's not enough of us. We can't keep up with the demand, et cetera, et cetera, et cetera. Now, that said, for my own clients that have been in that exact situation where we have a hard time finding someone for them, ConnectMD has been a real blessing because they've been able, either in I don't want to say a moment of crisis because I don't want to label anything for anyone, but in those times of need, there's been somebody there that they can get on the horn with and just chat through. And I haven't used that myself, but the feedback that I've gotten is that those therapists they're not hurrying you off the phone. There is no rush. They will sit there with you and just help you through whatever is going on. And I think that's a blessing anyway. And then secondly, if you need, like you mentioned earlier in the call, if there's a need for, maybe a psychologist does need to get involved, maybe a psychiatrist needs to get involved, they can refer you even within the KMD network, which is amazing. So, and then I just want to say one last thing. We've had clients of ours, friends of ours, and also talking to those colleagues and their clients, folks that are on various state government programs, federal and state government programs. Medicare, Medicaid is what I'm talking about. And specifically, sometimes in those populations, it's even harder to get get someone, because not every provider out there accepts those for various reasons or participates. And with KMD, even though some of these people with Medicare, Medicaid, and I'm going to use the word very loosely here, but they say they get, free healthcare, they're still subscribing to KMD because they have access. I mean, it's one thing to have it, quote, free from the government, but I mean, if you can't access it, it's not useful. So, I mean, there's so many layers of this for the behavioral health, for the mental health aspects. Tell us a little bit more how that works. How does behavioral health work? Thank you.
So it's very, very simple. So there's an 800 number that you call, and our behavioral health partners are unbelievable. You call, say, here's what's going on. They obviously make sure that you are part of our network, and within 5 minutes, you should be able to talk to a counselor of what's going on in your life. We also, and that is on the mental health side, we also have counselors that can talk you through finances and other things that are on there that most people don't even know about. So, but yeah, mental health is, especially since COVID is off the charts. It's very, very hard to find a counselor that you can talk to. But with us, it's about 5-6 minutes. They'll get a counselor on the phone with you. And, you never know where people are at any point in their life, where they are emotionally. And it's a great thing to have for anybody to be able to get on and talk to somebody else. Because, you need a third party, in my opinion. It's great to have third-party validation of what's going on with you, because you can talk to your family, you can talk to your friends, but somebody that's not invested, to have that outlet to talk to somebody is just an amazing thing to have.
I want to go into the pricing again. You said $60 gets you vision, dental, and chiropractic.
Yeah.
And I guess, how does that say? So say I needed to go to
you get discounts on vision, dental, and chiropractic, up to 50% off within our network of providers. And we have thousands of providers all over the country in our network. So you physically go to the dentist, and like the teeth cleaning, if you don't have Delta Dental, or I think they pay for 3 cleanings a year. If you don't have anything, instead of like $120 for an adult cleaning, it might be like $65. So they get that discount.
That's super cool, because I'm sure there's a lot of people out there that will watch this and be like, well, I don't have any insurance. And I've never had insurance my entire life, they're thinking. Or why would I have that? That costs too much. And now you're saying that they can jump on and be a member and pay the lowest tier and get access to vision, dental, and chiropractic. Because when I think about even paying 50% of a bill for a provider like that, that is a massive service to people. I mean, that's an in-person visit to a qualified eye doctor, dentist. I mean, there's so many people out there that won't go take care of their teeth because they know it's a big bill, and they'll let the thing decay, and next thing you know, it's like the domino effect. The one next to it starts getting jacked up. The one next to it starts getting jacked up, and then their self-esteem starts to drop, and then their quality of life starts to drop, and now they get an infection. What do? Now it's 30 times the amount of cost for that bill, when they could have just gone in and had that simple procedure done and had the quality of life restored quickly. I just think that the real case scenarios is people don't think about this.
They really don't. And you know what's great about it is it's the membership is so robust, and it gives you, there's discounts everywhere that you go. I want to take one little message a specialist. When you have the gold or platinum plan, you can message a specialist. I'm going to take you down a road on this really quick. So if you hurt your knee, what happens? You have to go to your primary care. They do all the x-rays, copays, deductibles, out-of-pocket expenses. Then they're going to refer you to an orthopedic if they think something needs to be done. Then you got copays, deductibles, out-of-pocket, all that kind of stuff. When with ConnectMD, if your knee is swollen, you can take a picture of your knee, upload it into a portal, send it off to a sports medicine guy, and say, "Here's what's going on. Here's what I did. What do you think?" That's
I just want to. JP, I just want to comment on that. Like literally, I mentioned my daughter in Utah. That's exactly what happened to her. She was hiking with her knee and did exactly what you said, and it worked exactly like you said it would. Yeah,
and they can say, maybe take ibuprofen regimen, see if the swelling goes down. If it doesn't, then you might consider going to an orthopedic, specialist. So, but sometimes that works, and if that did work. Not saying that does every time, but if that did work, that just saved that person about half of what it cost for the membership for the entire year. Just that one incident for one person. Now you got 7 other people in the membership, and if they all need to do the same thing, the membership is going to save people thousands of dollars a year, or can.
Well, going back to your origin story, now people have a doctor in their pocket.
Provider in their pocket. That's
just like you did.
Yeah.
And you had that because of your connections and the life that you built for yourself. A lot of people don't have those same connections.
100%.
So now they get the peace of mind with having the doctor in their pocket 24 hours a day, no matter where they are, no matter what happens. And they get the discounts on their meds. They get the discounts on providers. So many different benefits to being a part of the network. I just think to me, I don't like the phraseology of a no-brainer, but this is really a no-brainer. Like, it's really like, why wouldn't you? Like, I mean, I can waste $100 a day for real. Like, I can take 3 Uber rides and I'm out of $100. Like, you can pay for this $100 a month or $60 a month. Like, I'll go get a steak dinner. It costs me $60.
Oh, yeah, sure.
And you can get your care for the whole month. I just think just the price points should excite people to say, this is something that's going to get me better faster. And that's the impetus of our show. What are you doing to get people better faster? Well, this is like the gold star standard of how you get people better faster. Is you provide a service to them that gives them peace of mind, that they get access points to these people. And obviously the people that are going to listen to our show are going to be really excited for something like this that they can share with their friends and family. And if you don't have insurance, like, heck, this is like the plan. This is the plan that the uninsured should be flocking to you. They should be flocking to you and paying you hand over fist, month after month, time after time, for them and their 8 family members, without a doubt.
Yeah. Well, it's just all about getting the word out. And we're a company that's been in business about 6 years. We do a lot of business to business. So business owners, you can give this, because if you have 50 and below employees, you don't have to, provide healthcare insurance or healthcare insurance to your employees. So it's a great thing to give to your employees. It's $100 a month. If you have 20 employees, it's $2,000 a year. And then they can all have, and their families can have access to a provider whenever they need one. So it's just a great deal all the way around for individuals and businesses.
I guess the track that I travel a lot, and Dr. Jason's talking about real life experiences. I travel abroad. Does this work for people that have your insurance plan that are like, say, Costa Rica, and they went jumping off a cliff?
Well, this is for all non-emergency. If they jump off a cliff and they have something happen, go to the let's do that. But the great thing about it, and it's in the United States only, but the great thing about this is Jason's from Iowa. He is in Maine right now. So that doesn't matter. If you guys are on a trip in Florida and you live in Alabama, you can still use ConnectMD, because whenever you get on there, if you call our 800 number to request a visit, they are going to say, what state are you in? Well, I'm in Florida. So wherever you are, if you're traveling, they'll find the CVS or Walgreens that's nearest to you if the doctor wants you to have a prescription. So it doesn't matter where you are in the United States, you can use this.
I had a quick, sorry guys, I lost my place here. There we go. JP, that's amazing too. Yeah, everywhere in the US. And like I said, for those of us that travel, I don't like to use the word no brainer either, but I do believe for so many different families, this fills so many gaps. Even for the individual, if I didn't have a family and I was on my own, I still think it's a great investment. So JP, I want to just pivot just a little bit. So I keep referring to you as a disruptor, and I haven't heard you quite say this term yet, but from my perspective, having worked both for and with insurance companies earlier in my career, but when I didn't know any better, and now kind of being on the other side of the fence, I see just such immense value in this. But I see you disrupting potentially the insurance model, only because, and I think I've heard various people say it's a very bloated model. It's pricey for a reason. There's a lot of middlemen. And what I feel like you've done is just kind of pulled the veil back and said, hey, this is actually what we can do for $100 a month, and so my question is, I would think insurance companies, the regular traditional industries would be noticing what you're doing. Have you had feedback from those industries? I'm just curious.
No, I haven't had any feedback. And I think it's quite the opposite, actually. So insurance companies, as a rule, they want to keep their money. They don't want to pay it out.
Right.
So if we're doing these, if people are members of ours, the insurance company isn't having to pay out anything.
Mm-hmm.
So I think they like it as a first line of defense, to be honest. But the problem with the insurance being a disruptor, I think it's more of a healthcare disruptor than an insurance disruptor. Insurance is good if you need, if you get cancer, if you need surgery, paying in that business, paying into that, it's like car insurance. It's for the wrecks. It's great to have when you have a wreck. So, but at the end of the day, we wish we could say if nothing happens, I should get that money back, but that's not the way it works. So we are a first line of defense before you go, because one of the biggest problems is the out-of-pocket expense, the co-pays, the deductibles. The average deductible, I'm not sure exactly what it is because it changes all the time, but I would say $1,500 to, is an average copay. And I've seen them up to $15,000, for, and I'm sure you have as a physician.
Oh, sure.
Those. So this cost you $1,200 a year to have our platinum plan. Average out-of-pocket expense is $1,500, or the average deductible is $1,500. So I say use us as a first line of defense. If you want insurance, go get insurance. You might need it someday. But we are a first line of defense, for cold, flu, sniffles, anything, a brick and mortar doctor can do that he doesn't actually physically put his hands on you, we can take care of. We can do lab work. They can order lab work. And by the way, lab work, everyone, you get 2 free CMPs a year, comprehensive metabolic panel, at either LabQuest or Core. They send it down there. That's included in your package. And dermatology, you get 2 free visits a year. You take a picture of a skin rash, whatever you got going on, upload it into your portal, and then a dermatologist will get back to you within 72 hours. And as you know, and I'm sure there's people out there watching, to get to see a dermatologist sometimes is a 6-month wait.
My dermatologist with my insurance is $100 out of pocket just to go see her anyway. Yeah. So like I said, be it included, I mean, same idea. I mean, all she's going to do, it's my favorite visit of the year where I get to, get naked in front of like her and her 2 nurses and they take pictures of my body. It's a great experience. I'm kidding. For me. Yeah, I feel bad for them, but it's nice to be able to upload that and just, hey, anything going on here. And it's just, like I said, I feel like there's just so many added services. So coming back to, thank you, by the way. I hadn't thought of this actually being a boon to insurance companies, and maybe even, being that front line where they're not having to pick up that slack. I love that perspective. Jim, go ahead.
Well, I can't help but think about like the money again. Like it always takes me the whole scenario. Like I always tell people this: there's no money in healthy people. Like the only money is for sick people. And it's a system that wants to keep people on the merry-go-round of the pills, potions, lotions. And I understand your model helps people with that, which I'm not opposed to it, but I want people to get off the stuff as fast as possible. I don't want lifestyle drugs in people's lives. I don't want them to have, health management through a pill, a potion, or a lotion. But I do think it's really great that people that are on that trend, they can get access to those services. And those people generally after 6 p.m., they're going to have an incident. And what happens at that point? They go to the emergency room like we discussed earlier. What happens at that point? They get that huge copay. What happens at that point? Now they have to go see a specialist. And it just ties them into this rotation where they could have just stopped the buck with $60 a month or $100 a month and had access to somebody that's going to give them guidance and give them direction to a discount provider or zero cost med or something at that level of access point to where they're not going to get into the situation where they're taking an ambulance to the ER for a non-emergency health condition that could be helped by a concierge call. And the big thing is that small amount that people pay for that monthly membership, like you said, it saves them from a long-term medical bankruptcy.
Yeah.
And I think that's a huge bomb to drop here. Is it saves people from long-term financial distress, and people over 65, like one of the main reasons they lose their homes is because of a medical health problem where they get bills and can't pay them, and then the medical mafia comes after them and makes them commit bankruptcy, and now they don't have the place that they worked their whole damn life for to keep. Yeah. And that's the problem for me.
Yeah, well, very clearly I know that's a problem, and medical debt is one of the biggest problems in our country. I forget what the percentage is, but you can chat GPT it to find out what the percentage of people that are in medical debt. But it all stems from non-emergencies. So ConnectMD is for all non-emergencies. If you have an emergency, you're having a chest pain, stuff like that, call an ambulance, call the ER, do what you need to do. We're all for non-emergency stuff. But to your point is that after 6 o'clock, usually there's nothing open and people end up going to the ER because they are sick or they have an issue, or somebody has a 5-year-old at 2 o'clock in the morning that has 102 fever. What am I going to do? Scared first parents, they go to the ER.
And so it never Jason, it never happens at a convenient time.
No, ever.
It's never 2 p.m. on a Thursday that something stupid happens. No, it's usually midnight when somebody starts getting a back pain and they're like, oh shit, is that a kidney stone? What do I do? Or they start getting that the fever. Like that happens at 10 p.m. when nobody's around. What do I do? My baby's sick now.
Then you have to get the whole house up, and let's say if you're a single mother, you have 3 kids, you've got to get everybody up and take them, when you could just call ConnectMD and say, here's what's going on. If our providers think there's something more serious going on, they are going to tell you, and they have told a lot of our patients, go to the ER, you need to be seen. So they will do that. But a quick, my child keeps grabbing her ear or something to that effect, then they can, diagnose them and get some medicine. And then if you go and it's amoxicillin or Z-Pak or something like that, it's probably going to be free.
Well, I just, our Jamie, for Joe Rogan's Jamie, ours is Rachel. And Rachel, our executive producer, just said, I see 41% have some form of medical debt. And I did the search myself also. Around 41% of U.S. adults have about of about 100 million people currently carry some form of medical or dental debt, including bills on credit cards, and collections are owed directly to providers. Um, Here's the stats. Nearly 55% of Americans have incurred medical debt at some point, and 27% are still paying it off. Roughly 8.6 of adults are reporting having medical debt based on surveys from 2019 to 2021, and around 6% of adults owe over $1,000 in medical bills, and 1% over $10,000. Among working age adults, 41% have medical bills problems of debt, totaling 72 million, plus 7 million older adults, bring a total of roughly 79 million Americans. 79
Wow.
million Americans are carrying medical debt because of probably something that they could pay $60 a month for and have access to a provider where they wouldn't have any of this dumbass debt that's really wrecking their finances, their quality of life. And like you said, if my mom, I was the youngest of five, and my mom was divorced at my when I was a little boy, and she didn't remarry ever in her life. And I would tell you, if my mom had access to this, with being a single mother parent of our family, and it would have covered the whole family, I could just think my life would be tremendously different at this point in my future would have been different, that my mom had this like safety button. Like it's like the easy button for moms. It's like the easy pathway for people to get clarity and their questions answered. And I guarantee you there's moms out there that are thinking, holy heck, this really exists. I need this now.
I think what people are thinking is what I was thinking when my friend Ray told me about JP and ConnectMD, which is it seems too good to be true. I mean, I'll be honest. That's if I was listening to this show right now, that's what I would be thinking. I mean, I don't want to, like I said, overstate it, oversell it. I've had nothing but great experiences. I've recommended it now to many, many people and clients and got nothing but good feedback. But JP, you have to have people say the same thing. Like, what's the catch, right? I mean, it's too good to be true. What's the catch?
Well, there's no catch, and we pride ourselves at ConnectMD, people over profit. I could build a lot more profit in there, but I'm a real advocate for people not having to choose between paying their electricity or paying their rent and getting a provider on the phone if they want to. So the margin is just, we're a business and we're here to, do our stuff. But the margin, of course, I could build in more margin. People go, oh, okay, that makes more sense. But I want it to be affordable for everyone. Am I going to say that the price is never going to go up with inflation and all this kind of stuff? But this is where we are today. And, just try us out. And what's great about us is it's month to month. You can cancel whatever you want. There's no long-term contracts. Try it out for a few months. If you don't like it, then, cancel it.
Well, I like the direction you guys are going, but let's say that I run a podcast called Cairo Hustle, and I wanted to get a Christmas gift of health, a ticket to better health for all of my staff. And I said, hey guys, I'm going to set you up with a ConnectMD plan. It's your Christmas bonus this year. When does that policy start? When does that policy end? Is it a 1-year policy that I'd buy $1,200 for each person on the team?
No, it's just month to month. And by the way, I just want to say that we are not insurance of any type. We are a healthcare membership, but you just pay monthly, 60, 80, or $100 a month. It's billed on your credit card, and then you cancel whenever you just drop us an email and say, hey, don't need the service anymore, and we'll be happy to cancel it for you.
And I've had a couple of business owner friends of mine that actually both of these were trucking companies, interestingly enough, where they had policies, insurance. So they're providing insurance because they're people over profits as well. They're smaller companies, but they're just electing to do this. But of course, those premiums for insurance are climbing and climbing and climbing. And you start making decisions about how much can I afford? And then, wow, they're not getting this, or it's what you could buy as an employer for your employees has changed radically in the last 5 to 10 years. For more money, employers can now buy less benefits. I don't know how else to say that to be clearer. So a lot of employers are they're like, they want to offer this, but at the same time, they know there's this gap. And I've known, like I said, a few business owners that, as James is mentioning for Cairo Hustle, you know, basically affording this for, rather than trying to get I don't know how to say this, but they're choosing plans for their employees that make sense, and then using KMD as a smart first line to make up the gap and the difference. And it becomes all of a sudden affordable for everybody. And even the employees themselves, they breathe a sigh of relief, because what they could have been offered otherwise wouldn't have been that front line. They even though they had health insurance, they couldn't go use it because it was still going to be massively out of pocket if they ever exercised what their employers were giving them. So the cool thing is, boy, coming full circle on this, insurance, to at least myself, has always been this way, but it seems very clear that, insurance, as you said, it's like, it's holy crap. Like, I got hit by a bus, I'm bleeding out, I've got a tumor, something's radically wrong. I mean, that's where insurance steps in for sure. But KMD fills so many roles in that middle ground. So I appreciate the people over profits position.
And I go back to people that have diabetes, maybe, or they have a heart condition that they're managing, and there's no shaking that. Like, it's a part of your life. Like, you have a bad ticker, like, yeah, stop eating bad stuff and start exercising more, obviously. But when you think about like the pre-existing conditions, and somebody jumps into a plan like this, I know that I was talking to you off camera about this, but how does it benefit somebody that's, say, they're insulin dependent? Like, how can a plan like this help them save on their monthly, like, actual real life hard number meds?
Well, when somebody's introducing you to ConnectMD, you can always look. We have a whole, with our pharmacy partner, we have a whole diabetic discount thing in our back office. So, if you need, like, what's it called? Metformin, that's on our formulary, zero cost. If you need actual diabetic supplies, we have a program for that as well. So, I understand all the chronic issues that people have, and we don't, if they have that, they can still join ConnectMD. So it's not, we don't turn anybody away.
Well, I mean, just that alone, like, there's people out there, like, in infirmary cases where they're not having a quality of life because it's either I eat or I buy my meds.
Right.
And now we can give people the opportunity to saving money to where they can put more food on their table.
Yeah, absolutely. And, listen, times get tough sometimes, and I know the struggle out there. I mean, the struggle out there is real. Sometimes people live in a certain bubble where they don't think about it, but the struggle is so real. I see it every single day. So, and we are giving people access to have peace of mind, most of all, peace of mind, and access to providers when their family is sick. But peace of mind, knowing, like Jason knows, that his kids on both coasts are going to be taken care of. If they are driving around or doing whatever they're doing and they start to feel sick, they get the flu, they get strep, they get something, that he knows that they're going to be taken care of. So, peace of mind is everything. If you're a mother with, a couple of kids, or a father with a couple of kids, just knowing that you can pick up the phone and tell them what's going on. If they're at a daycare or they're at school, you can, and you have to go pick them up, you can drive on the way and talk to a ConnectMD provider and say, here's what's going on with my child. The school nurse said this. Well, I think it's this. Let's take care of it like this. And by the time you get to the school, you can have a prescription waiting for you. I mean, the convenience of it is, and the peace of mind is everything.
Quick question. Oh, James, go ahead. I cut you off. No, go. Okay. I love the peace of mind as well. And I am just, again, captivated by the price point. I'm just in love with it, but I want to come back to, the $60, $80, $100 plans.
Right.
And I know it's month to month. I thought, if someone wants to try out the Cadillac, the $100 plan, and then they, and they love it, but for some reason few months from now, they're like, I don't want to quit ConnectMD. I got to keep that urgent care and the, whatever. Can they drop down to the lower tier plan and then move back up month to month, or how does that work?
Whenever they want to. So every single person has a account with ConnectMD, a login, so they can go in the back and they can upgrade, downgrade, cancel at any time they want. So just
that easy.
That easy.
Wow. I mean, it's like you've taken all the hard steps out, so I appreciate that.
Yeah.
So I have a question. And again, I think that I think this is the cusp of where we are. I mean, I really do. And you're leveraging. I see leveraging technology. You're working smarter, not harder. It's brilliant. Where do you think ConnectMD is going to be in, I don't know if you went 5 years, 10 years, but I mean, where are we going with tech and medicine?
My goal in 5 years is to have 1 million members. So if I can help 1 million people and their families have access to providers whenever they need them, that's a goal of mine. And that's what I want to see. So, in innovation, listen, in 5 years, there's talks of AI, doing some calls and stuff like that, which they're already in the works of doing that. Obviously, that is has to be a congressional thing to be able to implement that. But technology, I'm not sure exactly where that's going, but I know that one thing, and that is that people are always going to get sick at some point. And I want to jump like 3 conversations back to what James was saying, that he doesn't like people on chronic meds. I get that. I'm a advocate of that too, but sometimes people need them because they have issues. But within ConnectMD, when you have the gold and platinum plan, the message as specialist, there's an alternative doctors in there that can, if you have questions, hey, I don't want to take any meds for this. What do you suggest? So we have an alternative platform as well, because I know that is very important to a lot of people.
I think it's an amazing platform. I was kind of poking around on it. Because I just like you said, it's like a AAA membership for me. I've now used it one time. And I think, Rachel's used a couple of times, kids have used a couple of times. It's just one of those things where if any one of us uses it, let alone 2 of us, even in a calendar year, we're actually ahead financially. That makes sense, unfortunately, right? So like you said, it's AAA membership. It goes right there. And also, I just want to say that like I said, the very few interactions that we've had, your providers are very nice and caring people. Like I don't know if you've ever been to the doctor. I mean, who hasn't these days, right? Where you go and it's like, you're a number and they're quick and they're like in and out. And I mean, it's just like doc in the box, nobody cares. And your people, your providers, they'll make sure that you're okay and that you understand everything and that they've explained things well. And they don't, at least the few times I've interacted with them, they have not seemed hurried whatsoever. And they're just seem like genuinely nice people. So I don't know how you're finding these people, but keep it up.
Yeah, no, they're they really do genuinely care about people, and most doctors, I would say, are in it for the people. There's a few that are in it for the
sure,
but that's with any business. But they're really we've had great success and great feedback with our doctors.
You took a really tough situation and turned it into a positive thing for many people. Your vision is to help 1 million people. And I come from the entrepreneur space, and I have a lot of people always come to me and say, hey, how do I make it in this world? How do I go out and become a millionaire? And I say, go help 1 million people. And I'm very straight to the point with a lot of folks. When people come at me with pie in the sky eyes, and they're like, I want to be a podcaster or a YouTuber, and I want to be an influencer. I'm like, go help 1 million people, you'll be a millionaire. And yeah. I just love that your vision's to help 1 million people, because money is in service. I've had some bad times in my life, and one of my mentors once told me that if you want to get out of your own way, go serve. Serve more people, and your life will get better. And I think that that's a message I want to bring to people too. It's not just people fixing you. You're not a broken car. You have accountability for yourself too. And if you want to get a better quality of life, you can't just be dependent upon a system. You actually have to be that force of change in your own personal life as well. You have to be an active participant. It's great that there's a system like this, but if you want to get out of the mess that you're in with your health, you have to go out there and be proactive and do the right things and not depend on somebody else that's going to fix you like a broken car, because you're not a vehicle. You're a human, and you're not a human being. You're a human doing. And if you go out there and do more, you will get a better quality of life. And then you can take your $1 million idea and become a YouTuber or an influencer and get healthy and create a movement because you had a system that worked for you. And that's the thing that I love about what you're doing and what we're doing here is we're unifying a bigger message of a health freedom message. And that's the part where we didn't talk about is this gives people health freedom. It gives them the freedom of choice. They're not stuck in a system that's, I call it conveyor belt technology. We're still in the 1950s of healthcare trends of how people go down the conveyor belt, and this is the next thing you do, and this is the next thing you do, and this is the next thing you do. But this is a disruptor, like Dr. Jason opened it up with. You're a health provider disruptor, and it's helping people find solutions that they didn't know that were out there, and they didn't know that they needed it until they hear what we're doing here today on this interview, which I think is amazingly important for people to have access to, because a lot of people, I always say it time and time again, most people don't know where to go or who to trust. And
this is like Uber found a better way to get you from point A to point B. DoorDash found a better way to get your food to you. So we have found a better way to get healthcare to whoever needs it.
Well, Jason asked you where you saw 5 years from now, Dr. Jason. I see, if I could just be as open as I possibly can, I see you helping the veterinarian world. I see people being able to do this for their dogs. I see people do this for their cats.
Speaking of,
but wait, there's more.
There's more. So for $20 a month, all you pet lovers out there, you can have access to veterinarians 24 hours a day, 7 days a week. They don't write prescriptions, but they will help you. I called it the other day. I have 2 labs and a cat, and one of the labs was throwing up. I said, "Here's what's going on, blah blah." And I've done this before, and I'm sure all the
it's $300 bill.
Well, yeah, to take them to the vet, but you take them to the after hours, it's $500. So, and this costs you what?
$20 a month.
So $240 a year, less than probably one visit.
Yeah.
And I told him what was going on. He goes, don't worry about it. Just, do this, this, and this. And I did that, and it saved me $500 because I thought something was wrong. So, there's more. So we have pet care too.
Well, I mean, I'm not the biggest genius in the world, but I can start to see a linear pattern. Once we start to fix the human, then we get to say, well, what else is going on in the household? Well, there's pets, and they need access too. So it's really cool that you're doing that. I didn't know that. And guys that are out there watching or listening to this was not a teed up like situation where I had this prefabbed idea to like cook it up and say, hey, do you guys do pets too? Because I was just kind of future pacing him to say, hey, this would be a great inclusion also. I didn't know that it was already something that's already in place. So all you pet lovers out there, go out there and sign up for this, if not for you. Because here's the thing, JP, as Dr. Jason calls you, people will pay more out of pocket to take care of their pets and their vehicles than they will their own damn bodies.
Yeah, that's true. It's a very sad thing, but it is true. People, what's interesting, speaking of that, what's interesting the other day, I went to a juice place, and I spent $9 on a fresh squeezed large juice. $9. Okay. Well, I mean, it was like that. So I was telling a friend of mine, he goes, how much does this cost? I go, $9. He goes, I wouldn't spend $9 on a juice. And I go, dude, you'll spend $14 on a double vodka.
Right.
With no problems. He goes, I've never thought of it that way. You know what I mean? So people spend, but they don't spend for their health.
The price is the price.
Right. Well, I think it's interesting too. Coach of mine, Matt Lohman from years ago, a friend of mine now, he said that if you really want to understand people's priorities, just look at the way they spend their money. And I think it's an interesting perspective, just like you said with your friend with the double vodka martini or whatever that was, right? So it's true. And I want to go back again, yes, to the vet stuff, and I agree with everything that we chatted about there. But I want to go back to the vision, chiropractic, dentist, and those pieces. How do you find it's probably the same way, but your chiropractors and optometrists and dentists, like how do you find those people? Because it's different service or walk-in services.
Well, we have there's a network that we plug into.
Okay.
It's already established that we plug into, that we're members of, and that our members can be members of. So when you get on and you log into your portal, it'll say, you'll have a little tile that'll say, pharmacy or, vision or dental. So you click on dental, pops up, you type in your zip code, and it lists a plethora of dental people or chiropractors that are in our network. And then you actually physically get a ConnectMD discount card in the mail. And you can take that or give them the number whenever you call and to make sure they're still a part of the network. And then you go in and get your discount.
That's awesome.
Eventually it'll be a QR code on your phone, guys.
Or a tattoo.
Right.
To pay.
There's just so much good stuff here. I would like to talk real life scenarios. That's where I kind of bring it back, because we talk about the big idea, the big mission, and how it's helping people, the different tiers of people it helps, the different services that it's helping people with. Share with us and our audience a couple real life experiences that you have seen, that you have access to, that you've seen that people's lives have changed because of the services that they get through ConnectMD.
Well, I'll tell you one, is a lady called in, her stomach had been bothering her. She called in, said, here's where my stomach, and he goes, do you feel this, and this? And she says, yes. And he goes, and he said, you need to go to the ER right now. Go to the ER right now, hang up the phone, go straight to the ER. She went, and her appendix had bursted. And if she would have waited another hour, 2 hours, she could have been sepsis. So that is one of the great things. That's probably the best story I've heard, because it saved somebody's life, literally within a couple of hours. But I think, I hear all the time, and I get feedback all the time of, the chronic medications that they're getting for zero cost. One person was paying $700 a month, got them for zero cost. So that obviously more than paid for their membership. And just how it helps people and the mental health. I've gotten a lot of compliments on that. It's just, right now we're in the, I want to say infancy stages of ConnectMD, but I just can't wait till everybody hears about this, because it's such a needed thing out there, because the struggle's real. People are getting sicker. And one of the reasons they get sicker is they don't take care of themselves because they can't afford it.
Well, this isn't a game changer. This is the game.
Yeah. Well, I don't like to, we're definitely in the game. And, I think, for $100 a month to be able to get a primary care doctor that can do lab work, read your labs.
That's huge.
Yeah.
Mm-hmm.
$100 a month.
Well, I just think about my own mom. She's 91, and she has a care provider that lives with her. Thank God. But she's 91 going on 51 sometimes. James has met her, and she's a little spitfire. And but I know that before we had the care provider, and my mom needed meds, it wasn't that easy to just get to the doctor or just get meds refilled or anything like that. And what I love about this is that, like you said, with the Platinum plan, at least, those chronic meds can be delivered directly to her. She doesn't have to think about driving or arranging someone to drive her or anything like that. It just takes that away. So there's that barrier removed. As you said, it's for people like Rachel and I that have, I don't know, decent enough insurance. People say we have good insurance, but $7,500 in addition to our monthly premiums. just to talk with somebody. It's 75 to $100 just to, walk in the door, like you said. And that's not in the ER. That's just a regular scheduled doctor's visit or urgent care. So the financial barriers, the time barriers, that, like we talked about, the single mom with the 5 kids. And I mean, there's the layers of this, as James said, and as we've been saying, it really is in a good way disrupting the delivery or the potential delivery of healthcare services. I mean, it's just great.
I can't tell you the burden that people that have older people in their lives, they have to take time out of their life to take people to doctor's visits, and they sit there and they go pick them up. And just the caregiving, providing of an individual looking after one person, and to go get the prescriptions now once it gets like the script gets filled, and now we're waiting there. So like this takes away, it gives quality of life back to people, that they don't have to be married to the system. And the system doesn't save people time and money. It costs you more time and money. So if this is a part of the game, and it's a part of what we can help people with, then this is really something that should be on everybody's wish list, and they should start like checking this out like ASAP, because this is a solution for all of these people, chronic conditions, pre-existing conditions, people that need better teeth, people that need better eyes, people that need better spines. Like, these things are real life experiences that people need. We talked about the emergency services. We talked about the savings. We talked about the meds provided with zero down that are inside of the packages that you guys do. Like, there's so much benefit. And I think that people have been thinking about what you thought about that night walking around your neighborhood for over a decade now. I bet you there's people out there like, why doesn't something like this exist? And now it does. And I think that that's just a really cool introduction to people in our audience, that this is something that's real life that you can use today.
Mm-hmm.
And just to kind of talk about people over profits again, JP, and I don't want to, I'm going to get the words wrong, but you have when the agents help bring in 3 new members, you're giving a membership away. Am I saying this correctly?
Yes.
Can you? Yeah.
So I implemented something that I call Connect MD Cares, because of that situation that I saw with the lady and her little, I'm assuming it was 5-year-old that was coughing. They couldn't. So Connect MD Cares is all of our agents are out there, selling Connect MD. So as soon as they enroll 3 people, we give away a Connect MD Cares package for free for 6 months to somebody that's really struggling. And, so they can get back on their feet. And we just implemented that, I think, a couple months ago, but it's a project that I'm, some philanthropy, that I really wanted to do. And it's a great program.
I mean, I know people right now that I would give that to.
Yeah.
And
all 3 people, James.
It's on. Get the game's on. And here's the other part of this, is there's people out there with addictions, real addictions. People are really struggling, that are having a hard time just participating in society. I mean, one of my best friends I grew up with, I just reached out to him 3 days ago. I asked him how he's doing. Struggling with addiction, alcoholism. He's homeless. And I think there's a lot of stuff like that out there. There's real world stuff that people don't want to talk about.
Well, and I think with addictions too, I mean, it's interesting. We're here in Portland, Maine, and I really love Portland, Maine. I just want to say that. And I love Maine. I love the coast. First time I've ever been here. It's beautiful. But Portland is currently having a housing, homeless, and drug problem. It's a crisis, in fact, is what they've labeled it. And it's very apparent walking around in the downtown areas. And anyway, that all said, what Rachel and I were discussing, and kind of James, to your point, is that, when we see a situation like this ballooning in any city, we always wonder, what's going on behind the scenes, what's driving this, what's the fuel behind it. And I think a lot of fuel with addiction, and boy, that's a can of worms that we can unpack for the next, 28 shows or more. But I think some of it is not getting the help in various ways earlier in the game. So again, sometimes maybe they just need somebody to talk to. It's just a really bad day. And it's like, I don't want to use today, but I just need somebody to talk to and talk me through it. I mean, those behavioral health therapists, I mean, they can jump on and just chat with them and maybe talk through it. If they need extra help, they can be referred in. If they've got chronic pain or chronic condition that for whatever reason they haven't quite figured out how to manage, ConnectMD offers, physical services like chiropractic care, but then also, medical services for that. So again, kind of getting an earlier intervention to kind of what we've been talking about, removing those barriers so folks can participate at an earlier stance before the dominoes start falling. And I know that's really big thinking, but ultimately I think that's where ConnectMD positions itself, is to, like JP was saying, be in that front line of therapy. But not just for immediate care. I really think that frontline therapy is going to affect the long-term PTSD and mental health issues that are around not having access. So, I mean, it's really big what you're doing here, Jace. It really is.
I bring it back to the basics. If people knew what we know, they'd do what we do. And there's a lot of people out there that if they could dream up what you've done, Jason Padgett, if they could dream up what you've done, it would be the fastest growing web search out there. They'd quit looking for WebMDs. They would quit self-diagnosing. They would quit trying to play doctor. And they would go and say, oh, I have access to a specialist. I have access to somebody that can give me the answers. I don't have to go play doctor for myself. I can have access to the real deal. And I think that that's a peace of mind quotient that a lot of people over times. I mean, I worked as a rehab tech for 6 years. I can't tell you how many people would come in and they played doctor and they WebMD'd themselves and they told me what their conditions were, what they did, or how they injured themselves and what their rehab was supposed to be like, or what their condition was. Well, I always believe this too. We don't want to guess with your health. And I think there's a lot of guessing going on out there because people don't want to put the few dollars in every month to have access to their high deductible plans. But if they knew that they could have a pay to play deal like ConnectMD, now they're actually getting access for real life stuff, and it's not going to cost them an arm and a leg, pun intended, for what they're looking for.
Right. I agree.
Amen. So we just, for full disclosure, to help everybody on the show, James and I and Rachel have aligned with ConnectMD to make this available to you guys that are listening. And we'll drop the link down in the show notes when we put everything together. But for those of you catching the live stream, it's James, you have it.
www.connectmd with a K agency.com/get better faster.
Yeah, so you can hop right in there and we'll put that in the show notes. And there's a whole bunch of information there. You can I think there's an introductory video. Certainly you can talk through the different levels of the plans. You can sign up right through that website, because I know that when I heard about it, I know you guys had to hear us chat for an hour and 15, 20 minutes on this to get to the goods. But the reality is everybody should just click that link. And coming back to what JP said, try it on for, a couple months.
Try it.
I mean, there's no long-term commitment. This isn't like, once a year you have to decide on the healthcare plan for the rest of the year. It's not like that at all. I mean, just hop in. This is my advice. I would hop in the Cadillac. It's only a few more bucks a month, and it's everything. And then you can kind of look at that and see what it feels like. And if it feels right, great. That's what we did, and that's what we stayed with. And if it feels like, I think the $80 plan or the $60 plan works better, that's great too. So that's what I would recommend. Just check it out. No long-term commitment. And JP, anything else that you would add to listeners that want to, check this out, learn more?
Or anything we didn't ask you?
Yeah. No, you know what? I think we covered just about everything, and I'm sure we'll do this again as ConnectMD evolves and grows. I would just say, take your health back in your hands. This is affordable for everyone, $60, $80, or $100 a month. And, we just love serving people, and, it should be a right for every person to be able to have access to a provider whenever they need one and not have to, either buy food or get medical attention. So we're just really, really happy to do it. And I want to thank James and Jason. Thanks for having me on. And I look forward to coming back very, very soon.
We'll definitely have you back, as KMD continues to grow and the movement continues to grow, for sure. Yeah. Thank you for being on today. I really appreciate it.
Well, I think we had a great episode today. I'm going to close out then and then say the outro script and just thank everybody for being here with us today. JP, the conversation was absolutely eye-opening. I think that people are going to, like I like to tell people when I give like talks at big conferences, I say you might want to take your pen and paper out because we might say a couple things today that you're going to want to take notes on. So this is my closure for people. Go back and listen to the whole episode. And if there are some things that you need some questions answered or asked, go to our website, getbetterfasterpodcast.com, and send us a message. We'd be happy to connect you with the plans that Jason's doing. And I'll also put in the website. You can go directly to him. That is www.KONNECTMDAGENCY.com/get better faster. And I just think that you're going to have questions. You're going to wonder if this covers MRIs. You're going to wonder if this covers CAT scans. You're going to wonder if this covers imaging. But at least you're going to be able to connect and get those questions answered. And it looks like, because I got a couple head shakes, it doesn't cover those services, but at least you can get your questions answered and get directions to a provider that can do that for you. And for our listeners who are tired of being held hostage by the insurance companies that take their money and give little back to you, ConnectMD represents real health freedom. And that's something that I live and die by, is medical health freedom. It's very important for people to understand that is something you should focus on. I've always been told that a man with his health has a million dreams. A man without his health has one. And this is like a caveat to people to have a million dreams instead of the one. And that one is to get healthy. And inside of the system, you get 24/7 virtual doctor. There's 0 prescriptions for acute conditions and coverage for 8 family members. 8 family members, guys. Single parent families. This is for you. This is what healthcare should look like for people that need it the most. So, folks, join the healthcare revolution. Head on over to the website, get registered, and get your access to the best care for less than a night out on town. Remember, nobody's come to save you. But solutions like this can provide your opportunity to save yourself. JP, thanks again. And all of you of our Get Better Faster Nation, thank you for listening to us and our continued support. And thank you for the best way that you can help us, guys, that are out there listening, that are part of our Get Better Faster Nation, is share the show. Share this episode with somebody that needs it. Somebody needs to hear this message. I have 10 people that I know need this message right now. So if you're out there watching this, you got to this point in the interview, please share the show. And don't forget to subscribe and never miss an episode, and get all the behind the scenes tomfoolery with Jason and Rachel and myself, with all of our amazing guests. We've got more coming your way. We've got more incredible guests lined up who will blow your mind, just like Jason Padgett did today. And we just want you to think about your health. And until next time, keep questioning everything and keep getting better faster, guys. Thanks for being with us today.
Love you, everybody. See ya. Thanks, JP.
Bye for now.
Thank you, guys.